your knee pain might not actually be coming from your knee. What if I told you an old scar somewhere else on your body could be contributing to it? When most people look at a scar, they only see where it is on the skin. But the body doesn't work in isolated pieces. Every part of your body is connected through your nervous system, your fascia, your muscles, your lymphatic system, and countless communication pathways. That's why the location of a scar matters. A scar on your abdomen doesn't just affect your abdomen. A scar on your ankle doesn't just affect your ankle. The body is one interconnected system. Think about your home's electrical wiring. If one wire is damaged in the wall, the problem may show up in a completely different room. The lamp that won't turn on isn't necessarily where the electrical problem is. The same principle can apply to the body. Sometimes the area that's hurting isn't the area causing the interference. Your body has become incredibly good at compensating. It shifts movement, it changes postures, it recruits different muscles. It adapts. Until one day, those compensations begin creating symptoms somewhere else. That is why I always ask patients about old surgeries and injuries. Not because I'm interested in every scar, but I'm really interested in understanding their body healing story, the history. A C-section from 20 years ago, an appendectomy as a teenager, a knee surgery, a child burn, a childhood burn, even an old injury you haven't thought about in decades. Your body remembers every injury. Sometimes a scar that no longer hurts is still influencing how the rest of your body heals and functions. Many people are surprised when they learn that symptoms they've been chasing for years may have developed after an injury that seemed completely unrelated. That doesn't necessarily mean the scar is the sole cause of their symptoms, but it can be one important piece of the puzzle that's often overlooked. One of the biggest mistakes we make is believing that once the skin heals, the job is finished. Healing on the outside and healing underneath are not always the same thing. The body may continue adapting around that scar for years. Sometimes those adaptations become so normal that people don't even realize they're compensating. They simply accept pain, stiffness, limited movement, or chronic discomfort as a part of getting older. But what if your body has simply been working around the interference all this time? That's a completely different way of thinking about healing. The goal isn't to blame every symptom on a scar. The goal is to stop overlooking something that could be contributing to the bigger picture. When we begin asking better questions, we often discover better answers. That's why I wrote the book about scars. It's called The Truth About Scars and Roadblocks to Healing. Because scars aren't simply marks on the skin. They may tell the story of how your body has been adapting for years. It's an understanding that, understanding that story may be the first step towards helping your body heal more completely.